If you have recently undergone heart surgery, whether it was bypass surgery, valve replacement, or any major cardiac procedure, one of the biggest fears patients have is this simple question: when can I start moving again, and what exercises are actually safe for my heart? And today I want to guide you step by step through the exact exercises I recommend to my own patients during recovery, because movement after surgery is not just about fitness. It is medicine, it is therapy, and in many ways it is as important as the surgery itself, because the right exercises improve blood circulation, prevent clots, reduce lung complications, protect your muscles from weakness, help your sternum heal correctly, improve your mood, and most importantly rebuild your confidence. And the key thing to remember is this: we are not training for a marathon, we are training your heart to heal safely, gradually, and intelligently. So let us begin from the very first stage, which is bed-level recovery. Because many people think exercise only means walking or gym workouts, but true cardiac rehabilitation starts even before you stand up. So exercise number 1 is deep breathing exercises, which may sound simple but are extremely powerful, because after surgery your lungs tend to become shallow due to pain or fear of coughing, which can lead to mucus buildup and infections. So slow deep breaths in through the nose and out through the mouth, repeated 10 to 15 times every hour, help open the lungs, improve oxygen delivery, and reduce pneumonia risk. And exercise number 2 is the incentive spirometer or balloon blowing technique, which strengthens your breathing muscles and keeps your lungs fully expanded. And then comes exercise number 3, gentle ankle pumps and foot circles while lying in bed, which improve blood flow in your legs and reduce the risk of dangerous clots known as deep vein thrombosis. And these tiny movements might feel too small to matter, but they are life-saving in the first few days. And once your doctor allows you to sit up, we progress to exercise number 4, seated posture correction and shoulder rolls, because many patients hunch forward protecting their chest, which restricts breathing and circulation. So sitting upright with relaxed shoulders and slow neck and shoulder movements helps restore normal posture and prevents stiffness. And then comes exercise number 5, supported sit-to-stand practice, which means learning how to stand up safely without straining your sternum by using your legs and not pushing heavily with your arms, because protecting the chest bone is critical during the first 6 weeks. And once you can stand comfortably, we move to exercise number 6, short supervised walking, which is the single most important recovery exercise, starting with just a few steps beside the bed, then to the corridor, then a few minutes at a time, because walking improves heart efficiency, boosts circulation, enhances lung capacity, controls blood sugar, and lifts mood dramatically. And the golden rule here is slow and steady, never rushing, always able to talk while walking, because breathlessness or chest pain means you must slow down. And after walking becomes easier, we add exercise number 7, light range of motion arm movements, such as gentle arm lifts below shoulder level, which prevents stiffness but still protect the sternum. And remember, no heavy lifting or pushing for at least 6 to 8 weeks. And then exercise number 8 is stair climbing practice, once approved by your doctor, performed slowly with handrail support and controlled breathing, because stairs train both strength and endurance but must be done safely to avoid fatigue. And then exercise number 9 focuses on light resistance training using very light weights or resistance bands under supervision, which rebuilds lost muscle strength, improves metabolism, and helps you return to daily activities like carrying groceries or household work. And finally, exercise number 10, which I personally consider the most important long-term habit, is structured daily walking progression, starting with 5 minutes, then 10, then 20, eventually reach 30 to 45 minutes most days of the week, because consistent walking transforms your heart health, lowers blood pressure, reduces cholesterol, controls weight, and strengthens both the body and mind. And throughout all these stages you must listen carefully to your body. Avoid sudden, jerky movements, stop if you feel dizziness or chest discomfort, stay hydrated, wear comfortable footwear, and most importantly, never compare yourself to others, because recovery is personal and not a race. And what I tell every patient is this: your heart has just survived a major surgery, treat it with patience and respect, progress slowly, celebrate small improvements, and trust the process. Because each small step today builds the strong, healthy heart you will live with for decades to come. And if you follow these 10 exercises consistently and safely, You will not only recover faster, but you will feel stronger, more confident, and more in control of your life again. And that is the true goal of cardiac rehabilitation, not just surviving, but returning to living fully, actively, and fearlessly.